Hello, everybody. Welcome to the channel. My name is Dr. Stephen Stokes, and I am in Southwest Florida. I've been in practice since 2001. I own Advanced Pain Solutions. Today, we're going to talk about knee pain. This is a request from a YouTube subscriber. They want to know about knee pain. I'm here to serve. If you'd like to know more about me, you can check me out on drstephenstokes.com, where there are free downloads of my books, articles, all sorts of fun things. So let's talk about the knee. If you're having problems with your knee, and the first thing I want you to do is get an MRI, no matter what. You cannot diagnose the knee from an X-ray. You must have an MRI. So the MRI is going to show you a couple of things. If your MRI says that you have a full tear of the ligaments of your knee, meaning that you have a ligament in your knee that is fully torn, then you're probably going to have surgery, and that's non-negotiable. That's it. Simple. If, however, the MRI results say something like degenerative arthritis, osteoarthritis, degenerative meniscus, meniscal tear, or partial tear, then chances are you can get rid of your pain and symptoms and heal your knee without surgery or medicines. And that's what we're going to focus on today. For the treatment of the knee, we divide it into two categories, chemical and structural. Everybody forgets about the chemical aspect, and that's at least 50% of your problem. Now, that's important for you to really understand that. So even if you were out jogging or playing hockey or something and you tore your meniscus in your knee, you did a physical trauma, you tore your meniscus, even if you did that, the physical tear is only 50% of your problem. There is still a chemical problem that's at least 50% of your issue that we have to address. So how do we address the chemistry first? We do that by decreasing inflammation, decreasing pain, and stimulating the healing. We stimulate the healing by causing a process called angiogenesis to happen in the knee. Angiogenesis is a splitting of existing blood vessels, a branching of existing blood vessels into new blood vessels so that the injury can get more blood and oxygen. And that's really important. So we use herbs to get all these things to happen. So first of all, with the inflammation, we want to get that down. How we do that? We take a product called Boswellia complex, and this is going to have a high dose of Boswellia, turmeric, ginger, and celery seed, all in one tablet. You're going to take these. You may take anywhere from 3 to 9 of those a day with food, and that's going to rapidly bring the inflammation of the injury down. It's going to stop that process of inflammation so that we can work on the healing. Along with the Boswellia complex, I want you to load up on omega-3 fatty acids. I like calamari oil, but there are others that work equally good, but calamari oil I think is one of the best. And what that's going to do is the omega-3 fatty acids are going to go in and they're going to help stop your body's natural process of destruction. When you hurt something in your body, the first thing your body does is create inflammation. It goes in there and it basically scrubs the area clean, and it causes even more destruction. The omega-3 fatty acids are going to stop that process from happening. And I did a whole video on inflammation, and if you're interested in that mechanism, you should watch that video. So we've got the Boswellia complex, we've got the omega-3 fatty acids, and we're just loading up on this. Then what we want to do is we want to stop using different activities that causes the knee pain. So if it hurts for you to walk, I want you to limit walking. If it hurts for you to go upstairs, take the elevator. You have got to stop sending the pain signal to the brain from the injured area. You cannot exercise the knee better. So stop trying, okay? People have these weird ideas that they have a bad knee and that they're going to get out on the street. I see it here in front of my house. They get out on the street with a knee brace and they force themselves to walk. Not a very good idea. You're going to do more damage. Let's first of all get the inflammation down, get the pain down, get the knee healing, and then when the structures are ready, we can start walking again. So I want you to stop doing rehab on the knee and focus on taking the herbs that I've just talked about. Also, I want you to take another herb called Gotu Kola. And Gotu Kola is the very best herb that I know of that will influence that process of angiogenesis. It's going to help your body grow new blood vessels into the injury, supply lots of blood and oxygen to the knee. If it's a degenerative meniscus or a torn meniscus or just osteoarthritis, it's going to really help that area. So you're going to take Gotu Kola. And again, you're going to take this 3 times a day with your food. Finally, I also like collagen. And I like a product called Collagen C from Standard Process. And I'd recommend loading up on collagen throughout the entire process. And this process is going to take 4 to 6 weeks. So during that time, you want to take lots of collagen, and you want to eat a diet that's high in fats and protein. You can get a download of the diet I recommend, the anti-inflammatory diet I recommend. That's also endorsed by Duke University. It's on my website. You can download it. It's a free download. So you want to eat that as well. You know, if you are 50 pounds overweight and you've got knee pain and you think that you're going to go get surgery and it's going to get rid of your knee pain, it's probably not going to be the answer, right? So I recommend working on the chemistry, working on the diet, getting that stuff dialed in is always a good idea. And I really encourage you to take a look at that before you go under the knife if you have knee pain. So that takes care of the chemistry. Now, what about the stuff everybody wants to know, right? How do we treat the structure? So there are a lot of different ways to treat the structure. They're all based on things that are going to help the knee heal quickly, help the tissues repair. Things that I have seen not work long-term are things like chicken fat injections. I have not seen umbilical cord stem cell injections work very good. Lots of stuff like that. What I find works the best for the knee are simple things, but it takes time, okay? The cartilage of the knee takes up to 500 days to heal. That's a year and a half. So you're not going to achieve success with a couple of treatments on your knee. Keep that in mind. That's why it's important to develop a home care strategy, something you can do a lot over a longer period of time. Now, I'm recommending you do this process for 4 to 6 weeks. At that time, you should have enough healing in the knee that you're confident that this is working. If in 4 to 6 weeks of this, there's no change, then it's not working. You have to look at other options for sure. So I mentioned I don't want you to work out and I don't want you to exercise the knee, but here's what I want you to start doing. I want you to move the knee without activating the nociceptors or the pain receptors. One of the great things you can do is called recumbent biking, recumbent stationary biking. And it's where you sit in a chair and you pedal. And you can buy a little pedaler and use it with a chair in your home, or you can go to Walmart and you can buy the whole setup where there's a chair attached to the bike pedals. But I want you to pedal if possible. If that's something you can do, if you have the resources for that, then I want you to pedal for a minimum of 12 minutes 3 times a day. That's it. I don't want you to get on there and pedal for an hour. I want you to pedal for 12 minutes. So it's a 12-minute session 3 times a day, spread out. And that should be enough to stimulate the regeneration of the knee and getting the blood in there along with the herbs that I've described that you should take. Next thing I want you to do, and by the way, if you can't get a pedaler, you can still do the next thing. I mean, you're going to go through this process. You're going to try to do as much of this as possible. The next thing I want you to do is I want you to go and buy a 3-pound, a 5-pound, and maybe an 8-pound set of ankle weights. And I want you to put the ankle weights around your ankles, and then I want you to hang your feet off the edge of a chair or off the edge of a table. And what you can do is you can get like a pool noodle or a bolster, and you can put that behind your knees like this so that your feet are dangling. So your feet are not touching the floor, right? They're just hanging. And you're going to have those ankle weights around the ankles. And what that's going to do is it's going to take the knee joint and you're going to bend it over the chair. And then the ankle weights are going to also distract that joint even more. So we're going to get this decompression of the knee joint. And while the knee is in that decompressed state, I want you to gently flutter kick your feet like this. Let those feet hang and let them swing like a pendulum, okay? Don't activate the muscles of your leg. Don't activate your quadriceps. Don't activate your hamstrings. Just let the feet hang and swing like a pendulum. And this pendulum swinging is what you're after. And that's going to decompress the knee joint and also get blood and oxygen into that area, into that vital area. Now, as far as how long you do that for, again, you don't want to do it for more than 12 minutes. And you may want to start off and do that for 5 or 6 minutes. If you're doing these things and it's causing more pain, you're doing too much, you're doing it incorrectly, or it's not going to work for you. We don't want to fire any pain signals during any of these processes. If we do, it's going to be counterproductive. Keep that in mind. Okay, another thing we want to do is we want to start to desensitize the nerves around the knees. And this is difficult, right? there's lots of ways to do this, lots of fascia sort of techniques, but most of them are going to cause too much pain. So in the past, for example, I brought some of my toys here, and these really are different things that you can use to work that area to give yourself some stimulation and to help to desensitize those active pain receptors. Now, the problem is this. This is a lacrosse ball, very popular among CrossFit practitioners, right, for doing fascia work and muscle work. You can take this and use this on the back of your leg and behind your knee, and you can roll on this, and you're going to find likely that it's going to cause you a real increase in pain. If you roll on this, you're going to have more pain for probably several days after because your knee is so sensitive. Likewise, I have this one. This is a vibrating ball, so this rolls like the lacrosse ball, but it vibrates as well, so it ups the intensity. I have these foam rollers, right? This one vibrates where you can roll the back of your leg on this here and roll your side of your leg on this, and they're all great, but man, if you start doing those right out of the box, you're not going to be able to walk for a couple of days afterwards. That's been my experience, okay? It's just way too intense for someone that's not an athlete to get in there and start mashing up their muscles around that knee joint. And so, what I find that works better than anything is a tiger tail. This is what I call a tiger tail. And I think it's called a tiger tail because the original ones were striped as well. They were like orange and black. This one is not, as you see, but it's the same idea. So there's two handles, and there's this roller in the center. And what you're going to do with this is you're going to take it, and you're going to very gently, and I mean very gently, above the knee, and you're going to use it on the side of the knee, like this. You're going to use it on the outside of the knee, the tensor fasciae lata. And you're going to use it like this, and it's gentle, right? It's so gentle. I'm not even putting hardly any pressure at all. I'm not trying to mash the knee. You can use it on behind the knee here, on the hamstring, and up on the back. And you can use it here on the front, right here, on the tibialis anterior, and on the calf muscle. The object here is not to try and roll out the muscles. It's just to stimulate the skin receptors. All the pain receptors are in the skin layer. That's where most of them are. And all we want to do is get the area used to pressure, right? And you can see the difference between using something like this and then, using something like this where you're just mashing with your body weight. It's too intense. It's going to cause more damage. So you get one of these tiger tails and you can use this. And this is a tool that I recommend for all people who have things like fibromyalgia, chronic pain syndromes. This is a great device that you can use to get back normal sensations in an area without really damaging yourself. A lot of my clients, they will say, for example, that like a massage is just too intense. The tiger tail is the answer. Also, if you don't have a tiger tail, you can use a scrub brush. So one of these bath brushes with this is soft bristles. You can take this, you can do the same thing. You can just use this and you can stimulate the skin receptors all along the knee joint, right? You just do this, the same pattern, and this will help to desensitize the area to pain, and your brain will start to go, oh yeah, it's getting those signals from the knee, and instead of firing off a pain signal, it'll say normal. Also, for the knee, stop using ice. Also for the knee, we don't want to use ice, okay? We want to use moist heat. And the best moist heating pads are made by a company called Battle Creek Medical. You should buy one of those, and you should use it on the knee several times a day as therapy. Every time you use that heating pad, that moist heating pad, you're bringing blood and oxygen into the knee, and that is going to ignite those herbs that we're taking to really cause a lot of healing to occur in the damaged knee joint. But we don't want to use ice, no matter what you've heard in the past. Ice may limit swelling. Ice may also reduce pain. But in the long term, ice is going to curtail healing. We always want to use moist heat. We do not want to use ice. People say, well, you got to use ice because if you put heat on it, it's just going to cause more swelling and more inflammation. And that is not true. If you put moist heat on it, it's going to dilate blood vessels, bring blood flow and circulation through the knee, which is going to reduce inflammation. It's going to feel good, and it's going to calm down the nervous system. Ice is not going to calm down the nervous system. Ice is going to stimulate the nervous system. So try the heat, don't try the ice. The last thing is if you feel like you need some support on the knee, if you feel that the knee, when you're just doing simple things like walking to the fridge, if you feel the knee is unstable, you can also greatly benefit by a knee ear brace. And the one that I recommend is made by a company called Disc Disease Solutions. Here's a picture of it on the screen. You can purchase this. They're very inexpensive. You put this on your knee, you inflate it with a little pump, and it compresses the knee joint, keeps everything nice and snug and tight. And that tightness does two things, right? It stabilizes the joint, which allows you to move it without pain because it keeps it in proper alignment, but also the compression. The compression is going to desensitize those nociceptors and stop the pain receptors or the pain nerves from firing to the brain. So compression is always going to feel good, and the ear knee brace is a great tool for that. At the very least, you would put a compression stocking, on the knee or wrap it or something like that. But I just find that the knee ear brace works a lot better. So I hope this was helpful. Reach out in the comments if you have any questions. You can contact me from my website with text message or email if you have any need for any more in-depth information. And don't forget to pick up a copy of my book, Heal Yourself, The 7 Steps to Innate Healing. There's a whole section in there on knee pain and what to do. And it's a free download on my website. So thank you very much. I hope this was useful. Please subscribe, and we'll talk again soon. Thank you.